Hi there, Luke here, your dietitian from Active Health, and today I wanted to talk to you a little bit about salt. So for years we've been told that salt is bad for us. Too much salt in our diet is going to be detrimental, and it leads to a higher risk of things like high blood pressure, which can lead to a higher risk of things like heart disease and stroke. But what you might often hear from our practitioners is that they want you to increase the amount of salt that you take in your diet. So why is there a discrepancy between these? Well, there are times when salt can be beneficial and necessary for our health, and times where it can be detrimental and unnecessary for our health. Here's why. Salt is really good at increasing our blood volume. It's good at helping us to retain that volume, and this helps us to be able to pump blood around our body more efficiently. Now, having a high amount of salt in the diet to make this happen would be good for someone who is living with orthostatic intolerance or POTS. And that's why many times we might prescribe a higher salt diet in the clinic. Salt, however, can be unnecessary and detrimental to our health when it's used in excess for flavouring and tasting of food, when there is no medically valid or reasonable reason for it to be used like this, and in someone who has perfectly good blood pressure control. That's when it might have a negative effect on health. So if you are prescribed a higher salt diet by anyone in the clinic for the management of your orthostatic intolerance or POTS, rest assured that it's not going to have a detrimental effect on your health. It's perfectly valid, and it's perfectly reasonable and needed to help manage that condition. And it's actually one of the staples of management of these blood pressure conditions. Hope that's been helpful. Please tag someone below if you think they might have had some conflicting feelings about whether they should increase their salt intake to manage their blood pressure condition. And if you have any questions, please tag the clinic below. Cheers.